In this video by Deck Plate we will be discussing how military training can lead to knee injuries, some of the most common knee injuries experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Understanding the impact: how military training can lead to knee injuries. Knee injuries among active-duty military are one of the most frequent musculoskeletal injuries and are often caused by exercise or intense physical activity or combat training. How military training can lead to knee injuries. Knee injuries pose a significant concern for military personnel, as they can impede their ability to perform their duties. They're also one of the most common injuries in military personnel, accounting for around 50% of musculoskeletal injuries, according to studies published in Military Medicine. Traumatic injuries. These can occur unexpectedly in military training or combat. For example, a soldier may hurt their knee while disembarking from a helicopter, landing awkwardly after a parachute jump, or slip and fall while sprinting. Similarly, they may twist their knee while engaged in combat or sprinting over rough terrain to make a cutoff time at a waypoint. Overuse injuries. Also relatively common, overuse injuries can include patellar tendinitis, iliotibial band syndrome, and chondromalacia patella, and can occur as a result of repetitive activities like marching, sprinting, and carrying heavy equipment. Another study published in Military Medicine discovered that similar injuries are common among military recruits, with up to 25% experiencing knee pain during basic training. Biomechanical injuries. Biomechanical issues such as malalignment, large muscular imbalances, or structural abnormalities in the knee joint can lead to some dysfunction and pain. For example, soldiers who carry high loads on one side of the body, or who wear gear that isn't fitted properly, might develop muscular imbalances that exert excessive stress on specific portions of the knee joint. Individuals with structural abnormalities, such as patellar malalignment, may also be more prone to knee pain. Repetitive stress. Military training frequently involves repetitive movements like running, marching, and squatting. The cumulative impact of these activities can lead to overuse injuries, including strains and stress on the knee joints. High-impact landings. Parachute training is a crucial aspect of military exercises. The forceful landings upon descent can subject the knees to significant impact, potentially causing trauma and injuries, such as ligament sprains or meniscus tears. Heavy load carrying. Carrying heavy equipment during exercises and missions places additional stress on the lower extremities, especially the knees. Prolonged load-bearing activities can contribute to conditions like patellofemoral pain syndrome or exacerbate pre-existing knee issues. Terrain challenges. Military personnel often navigate challenging terrains, including uneven surfaces and rough landscapes. Negotiating such environments can increase the risk of slips, falls, and twists, leading to injuries like dislocations or ligament damage in the knees. Inadequate conditioning and training techniques. Lack of proper conditioning or incorrect training techniques may contribute to poor biomechanics, predisposing individuals to knee injuries. Insufficient warm-up, improper form during exercises, and inadequate recovery practices can amplify the risk. Stress fractures and microtrauma. Intensive physical training can result in microtrauma to the bones, including the knee joints. Over time, this can accumulate and lead to stress fractures or other stress-related injuries, affecting the overall integrity of the knee structures. Sudden changes in direction. Combat scenarios may demand quick and abrupt changes in movement. Pivoting, turning, or evasive maneuvers under high-stress situations can strain the knee joints, potentially causing injuries such as anterior cruciate ligament tears or lateral collateral ligament injuries. Inadequate rest and recovery. Military training schedules can be demanding, sometimes allowing limited time for rest and recovery. Insufficient recovery periods between intense physical activities may lead to fatigue and compromise the body's ability to absorb impact, increasing vulnerability to knee injuries. Lack of individualized training. One-size-fits-all training programs may not consider individual variations in fitness levels, body mechanics, or pre-existing conditions. Tailoring training regimens to each soldier's specific needs can help reduce the risk of knee injuries by addressing individual vulnerabilities. Psychological stress and physical performance. The mental stress associated with military training and operations can impact physical performance. Stress may lead to altered movement patterns, reduced focus on proper techniques, and increased susceptibility to injuries, including those affecting the knees. Thank you for watching our video. Please don't forget to subscribe and like our videos.